Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday. Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPAR Protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All three of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th at SMX Aura, 8 a.m.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP, tapos siyempre mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. Minatapakan siya, nasugat yung paa niya, malit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang, marami na komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPAR. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka, tinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simple Nature.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're going to have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPAR Protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen and the top specialist in supporting cancer treatments. All 3 of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their stories and how they succeeded in fighting cancer. So once again, see you all June 7th, SMX Aura, 8 a.m.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made from a unique strain of high-grade microalgae known as PPARS. Backed by scientific research, PPARS have shown remarkable benefits in supporting cancer treatment, enhancing general health, and helping to reverse metabolic conditions such as hypertension, diabetes, and high cholesterol. Now, to quickly recap last week's webinar, we tackled a powerful topic entitled Stay Strong Through Conventional Treatments. It was a very informative session with plenty of great questions well addressed by our expert. Now, this week, we turn our focus on a deeply important matter because tonight's topic is entitled Managing Cancer Tumor Using PPAR Protocol. We understand that treatments like chemotherapy, radiation, and long-term medications can place a heavy burden on your body. At Simply Nature, our mission is to walk beside you naturally and safely while you follow your doctor's medical plan. In this supportive session, we'll explore how nutrition-targeted supplements, mindset practices, and gentle lifestyle shifts grounded in a PPAR protocol can contribute meaningfully to your wellness. You'll also gain real-life insights and empowering strategies from our experts to help you stay energized, hopeful, and resilient. Now, so without further ado, let's dive right in. We'll also be having the AMA or Ask Me Anything portion later, so please feel free to drop your questions in the comment section. Now, leading tonight's topic or discussion are two highly respected health experts. First off, it's an honor to introduce Dr. Jansen a graduate of St. Luke's College of Medicine and a diplomat of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Joining him is a successful entrepreneur and seasoned international speaker who brings deep insight in personal success and healthcare. He is the CEO and founding director of Simply Nature International, and of course, our PPARS expert from Singapore, Mr. Shyan Lim. Everyone, let's all watch this.
Hi everyone, welcome to another episode of Simply Healed. Today we're going to go into the topic of different types of tumors and the role of Simply Nature PPARS in situations where you find tumors or growths in your body. Over the past few years, I've been presenting to doctors, oncologists, medical oncologists, pediatric oncologists, surgical oncologists. I've presented to many integrative doctors who actually deal with other health issues apart from cancer, because when you have a tumor, it could be benign or it could be something not related to cancer. So today, our topic, I'm going to dive into the different types of cases where you have a growth in your body and then now you're really worried. What should you do? Okay, there's always a question of should I go for a biopsy? And things like that, okay? So let's start. Don't forget, there's an Ask Me Anything segment right after this discussion where you can ask specific questions, and both myself and if Dr. Jansen is joining me or any of our guest doctors, we will be here to answer your questions to the best of our ability, all right? Okay, let's go in first. You found a growth, a tumor in your body, okay? First question many people ask is, should I go for a biopsy? Okay, the answer is you got to understand what a biopsy is for, right? A biopsy is for the doctor to clearly identify what type of cancer you have. And then you may be asking me, Shen, what do you mean by what type of cancer I have? I have a tumor in my breast, I have breast cancer. No, that is not true. Just breast cancer alone, there are 4 types. And a personal friend of mine, her breast cancer her one breast tumor had actually 4 different types of cancer cells. and not even all of them are breast cancer cells, right? So that was a rather complicated case. So for her, she actually chose not to do a biopsy. She chose not to do conventional medicine because she wanted to be treated naturally in the beginning. Unfortunately, in her case, her cancer was not so straightforward. It was actually a complicated one. Her cancer tumor had multiple different types of cancer cells. So this is why biopsies are important, okay? Now the question is, if you know that you have cancer and you don't want to treat it using conventional medicine, do you still need to do a biopsy? Talk to your oncologist. But I'm now just gonna give you a general guide, right? When do we do diagnosis or diagnostics? And a biopsy is a diagnostic procedure. When do we do it? When we want to determine how we're going to treat that illness. Okay? So back again, if you're going to do chemotherapy, you need to know what chemotherapy drugs to use, because every cancer type has different types of chemotherapy drugs. So the onco can't just make a guess, right? He has to know exactly what type of breast cancer you have, because different types of breast cancer has different types of chemotherapy drugs. So that also means if you do not intend to use conventional medicine, maybe because the patient is old or you have other medical reasons why you cannot or choose not to use conventional medicine, then perhaps the need for a biopsy is greatly diminished. Again, before you make that decision, consult with your primary care doctor, okay? And because he will know your full condition and he'll give you better advice. But general understanding, you go for diagnostics to find out what treatment you're going to use. So if you know what treatment you're going to use already and you are not planning to change your dosage or anything, then the need for a diagnostic procedure is no longer there. If your tumor is a cancer tumor, please refer to our other videos that talks about cancer tumors and how Simply Nature helps with cancer tumors. Or you can ask me during the Ask Me Anything segment. But today, since we're talking about other types of tumors, I just want to take the opportunity to talk about them instead of cancer, since we do cancer almost every week. Okay, so let's talk about other growths. I have this one very interesting. The worship leader in my church actually had nodules, right, in her throat, growing in her throat. So that's, I think, because she strained her voice as a singer, as a worshiper. But that's also a concern. She went to see five ENTs, not one, 5, because she wanted multiple opinions. And every ENT told her the nodules won't go away, she would have to operate to remove them, okay? And that she should, so that they don't grow bigger and affect her voice box even more. And of course, as a singer, a worshiper, she asked the question, will this affect my voice? And every ENT said yes. How much? They wouldn't say. So maybe it will affect only a little, or it could radically affect her ability to sing. Basically, none of them can give her any assurance how bad it will be, but they all guaranteed one thing: it will affect her voice. So, of course, we go to the same church. So when I found out, I said, you know what? Why don't you try Simply Nature PPAR Protocol? So she put her on a liquid extract. So she actually took the liquid extract for 3 days, and after that, she came down to the PPAR powder extract. Well, to cut the story short, after 10 days, or I think less than 10 days, I think on the second day itself, her voice came back. So when her nodules were there, she lost her voice, or very, very soft, right? And her doctor, her ENT, had told her, no more speaking for you. But I think after she took the liquid on the second or third day, she didn't realize it, but she started speaking to her husband. Okay, her voice came back, and it came back strong. So she was very encouraged by that. So that's the liquid, how fast the liquid was working for her. Now, after I think like 10 days or so, she went back for a checkup, and guess what? All the nodules were gone. Yep, you heard me right. They were gone. We'll talk about the mechanism of action after this. I just want to complete this testimonial, right? So all her nodules were gone, and her ENT said, it's a miracle. It's gone, it's okay. So she said, oh, she's so happy. She's about to leave the room. Her ENT said, no, come back. I can't believe it. Come back. Let me check another time. So it was so unbelievable for her ENT that he actually did a double take. Right? He put the scope in again. He looked a second time, and it was confirmed. It was clear. Okay. Now, am I saying that Simply Nature PPARS can remove all tumors? No, that's not what I am saying. All right. What I'm saying is this: our human body has the ability to manage tumors in our body. If not, you will be having tumors everywhere, right? You will. How many of you noticed, like when you bite the inside of your mouth, sometimes there will be a growth over there, right? Or when you cut yourself, then the scabs grow. Throughout your life, I am sure, one illness or another, you will notice there was something that growing, then after that it disappeared, right? Or on your foot, on your hands, or maybe even on your face. So I'm saying that the body actually has a way to get rid of unsanctioned or illegal growth that is not following the DNA pattern. As your body grows and regenerates, right, it follows a blueprint, which is your DNA. Of course, because so many cells are being reproduced, there will be errors. But the body also has ways to correct the errors, knowing that errors can happen. It's just like your temperature, right? No matter how hot or cold it is outside, it is always the same, 37 degrees Celsius inside. So your body can come back to a balance point. So your body has backup systems, mechanisms to bring you back to healthy state. So that is the same with the tumors as well. So what is cancer then? Cancer is actually doesn't happen overnight. Cancer develops over years. You and I, healthy people, have cancer cells also. But how come we don't develop cancer? It's because our body is able to get rid of the cancer cells that are growing. Okay? So basically the body has an anti-cancer mechanism. It's only when this mechanism doesn't work, maybe mostly due to our lifestyle, many times because of stress affecting the body's immune response, and that gives the cancer a break, a chance and opportunity to develop into a cancer tumor. Okay? So tumors are also grown this way, right? For ladies, you may have myomas in your womb. If you ask the OB-GYN, they say, these things happen. There's no specific explanation why you have PCOS and myomas. They happen. They are part and process of, life, the way your body functions. The body also has ways to get rid of it. Okay, so this is what PPARS does. PPARS doesn't act on the tumor. PPARS does not. Our protocols don't act on the tumor. Our protocols act on your body's systems, your immune system, your inflammation, how you modulate inflammation in your body, how your cells replicate, that's called cell delineation or maturation of cells, so that they don't duplicate in a wrong manner that leads to tumor growth. Our PPARS work on that. And that is what happened to the worship leader from my church, right? Her body was trying to get rid of the nodules that were formed maybe because she overstressed her voice box. So obviously the voice box also wants to regenerate, but it regenerated wrongly, so the nodules were formed. But it also has the ability to correct that. Okay? And that's what PPARS can do. My niece is also a perfect example. She had a growth on her inner lip that a pediatrician wanted to cut out. My sister was happy to go for the surgery because she said, just in case, let's just remove it. However, when she found out that my niece, who was 4 years old at that time, had to go under general anesthesia, she's like, no. I don't want my 4-year-old to go for general anesthesia. What if something goes wrong, brain damage, or doesn't wake up? These are always fears a parent will have. So what she did was that my mom told her, hey, why don't you try your Kuya's product? So many people are using his product. We are family. Why aren't you trying it? So she did. And to cut the long story short, within a month, my niece's abnormal growth in her inner lip disappeared. We had a medical conference at SMX where we met patients and clients, and there was a patient that came over, Junie, right? How many tumors? 13, it's caught on testimony. Just look at our YouTube channel, right? 13 heart tumors, benign, okay, not cancerous, benign, maybe 1 month or more. All 13 of these small growths disappear. Okay, will this happen for every client and patient? Will it happen for you? It depends on patient to patient's basis, all right? If you don't want to go for surgery, at least you now have an option to deal with your tumors. If you are still considering what path to take, whether to go for surgery, whether to take medication, and you're just considering, you're waiting, right? You're waiting. Maybe you say, give me 10 days, give me a week, give me a month to consider whether I want to go for surgery or not. Instead of just worrying for that 1 month, there are things that you can do. For example, go on to our Simply Nature PPAR liquid and powder extract protocol. Your body may react well and the tumor may start shrinking. Then your options change, right? If the tumor doesn't shrink or doesn't change much, don't worry. Nothing is sayang. Why? Because if you're going to go for surgery, you gotta make sure your comorbidities are under control. How's your blood cholesterol, your blood pressure, your blood sugar? How's your inflammation? All these will affect the success of your surgery and how you recover from surgery. So Simply Nature PPAR extracts are able to deal with and manage all these comorbidities that I've talked about. It manages your inflammation, it manages your immune response, it manages your metabolic pathways. So that affects your blood sugar, blood cholesterol, and of course, your blood pressure. So there is no loss, okay? So let's go back to the main topic before I move on to the Ask Me Anything segment. If you have a tumor, and we are now going to talk about benign tumors because we deal so much with cancer tumors, okay? Just look at our other episodes. If you have a benign tumor and you don't know what to do, the first thing you can do is to go on our Simply Nature PPAR protocols because it will trigger the immune response, which is largely responsible to deal with any unsanctioned or illegal growths, okay? So a benign tumor is still an illegal growth. It's not proper. So the body actually has a way to correct it, and your immune response is actually the primary mechanism. And our PPAR protocol triggers the immune response, okay, pathway. So it modulates that. It increases your macrophage cell activity, your NK cell. Your macrophage cell activity is basically the cell that eats up the wrong cells. So that includes benign tumors as well, not just cancer, even benign tumors. So that's what it's like, the garbage collector or the trash compactor of your body, right? It's like that garbage truck that gobbles up the trash. Okay, that's like your macrophage cells. So that's what our Simply Nature PPARs will trigger, right? It will also trigger your dendritic cells, which help to identify any unusual, not normal growths, right? And that includes benign tumors as well. So I came back when I was at PPAR, which is a conference for medical doctors, MDs, full medical doctors, but these are doctors that practice integrative medicine. That means they do use supplementation on top of conventional medicine. One of the top endocrinologists that was attending there actually stood up because one of the attendees was asking, PCOS, can Simply Nature PPARs help with PCOS? And before I can answer, he actually stood up and he went to the mic and said, yes, it does. Just use soft gel capsule. It will work for the PCOS. So that's here another example. So if any of you have PCOS, Simply Nature soft gel capsules will be your best approach, right? Even before you see any doctor. You can already start on it and it will not have any contraindications with medication, so you can feel free and comfortable to do so. So simply drop us a note. Our customer service will answer all your questions, and if they can't, they will refer you to a healthcare specialist who will then help you make appointment with doctors, medical doctors that work with us so that you can get medical advice in the event that you need them. All right, so I hope I've given those with growths, tumors, some hope. Okay, good news is that your tumor is benign, it's not cancer. And even better news, you have now options to treat these tumors, all right? Not just surgery and not just medicine, there's other things that you can do as well. So let's move to our Ask Me Anything segment, and I'll answer your questions specifically.
And we're back. Thank you so much, Sir Shyan. I am so sure that a lot of our viewers have picked up valuable insights from this talk and have a lot of questions in mind right now. Well, good news, because we are now in our AMA or Ask Me Anything portion of the webinar. But before we dive right in, of course, I'd like to take a moment to warmly greet everyone joining us tonight, particularly Ms. Minda Banela. Wow, Ms. Dr. Grace Lim Kalalan. Hello po, good evening. We also have watching tonight Ms. Dina Oba, Noemi Veras, Marivic Dunca, Antonio Tan, Ms. Jeanette Ku of Child House Manila. Maraming salamat. You are watching tonight. Ms. Lini Tumagan and Ms. Lucy Mariano. Thank you so much. We really appreciate your presence and your being able to be with us, joining our webinar. Now, well, all right, let's not keep you waiting any longer. I can see a lot of questions coming in as well. So in today's world where so many health opinions compete for attention, it's very important to hear directly from trusted experts. So to help us answer your questions with clarity and authority, I'd like to once again call on our lifestyle medicine doctor and integrative oncology specialist, Dr. Jansen Kalalan, and CEO and founding director of Simply Nature International, fresh from Singapore, Mr. Shyan Lim. Wow, I miss you both. Hello, Dr. Chen. Hello, Sir Shyan.
Hello. I think last week, Sheila did it by herself with Jhen.
Right.
All right. First, a big shout out to Miss Janet from Child House. Janet, I'm looking forward to seeing you this coming Saturday. And I know Miss Janet has invited so many guests from Asian Hospital, so I look forward to meeting them as well. Janet has been, I think we've not seen each other for a few months. The last time was Mother Raya's birthday, but I was not feeling well that day. So look forward to seeing you and catching up with you this coming Saturday. Yeah. So Sheila, let's start.
Oh, that's right. We are so excited to see all of them. Now, for our first question for tonight, coming from Mr. Miss Shawnee Tatad, I just want to ask, can this be taken alongside injection of filgrastim? So I think she is asking about PPARS. Is PPARS okay to be taken even the patient is being injected with filgrastim?
Doc, you have any question?
Yeah. Actually, it is best used together with filgrastim.
Wow.
For my other patients, even when they use PPARs, no, sometimes WBC counts still go down. And to a point that sometimes, oncologists would want to be more proactive. So they would patients to inject filgrastim already so as not to allow the WBC to go down further. Okay, so sometimes WBC around 2 would sometimes trigger oncologists to advise so, but more so if the BC is less than 1. Okay, so this is how PPARS is. No, so it's not 100% sure thing that WBC will not go down because you're taking chemotherapy. But nevertheless, this is the beauty behind PPARS. Okay? When you use filgrastim together with it, the dosing requirement for less compared to in a situation wherein you're not using PPARS. Yeah, because PPARS has an effect that it activates cellular differentiation. So this is the medical term for cell maturing. Yeah, okay. So it allows faster maturation of cells. So when you inject filgrastim, then you would, for a smaller amount of dose, you would get the usual effect that you would want. Yeah. So sometimes it takes fewer injections for patients, and they suddenly have normal WBC counts already. I have encountered patients also wherein we overshot the upper limit of normal. So from having a WBC count of 1 to 2, suddenly they have a WBC count of 15,000 of 15. Yeah, and the cutoff is 10, So this is the beauty behind it. Now, of course, you would wonder, no, hey doc, 15,000, is this dangerous? Because this might signify infection. No. If it is clear that you don't have any symptoms of infection or there's no source of infection, then yeah, it's because of the filgrastim. Okay, so I have encountered such patients, and yeah, so that's my experience.
Oh, I just wanted to say that that's exactly why we are excited to on our program. We never say go all natural, we or just all conventional, right? So here we really have real life examples how conventional medicines, drugs can work very well with our natural protocols. And what we need is actually understanding. So when an expert like Dr. Johnson shares, it gives us understanding. Doc, just for your just to affirm what you said, when we were preparing our presentation for the pediatric oncologist, when we looked at our research, we actually no, there was a component that says that our PPAR extracts actually increase CSFs, which actually what filgrastim is, right? Colony stimulating factors. So that's where the synergy comes in. So guys, our listeners, that's the science behind it. I don't think we want to go into it because Dr. Jansen will give us an in-depth medical lecture already. So we'll leave it at here and we'll go to the next question. Sheila?
All right. Okay, so for our next question, I think this was thrown to us privately by one of our viewers coming from, let's call her Jennifer. The question is, EGFR dropped from 88 last month down to 42 this month. How will I give the PPARS liquid? And health issues of my father are Alzheimer's, Parkinson's, prostate, and stroke. She also already have a follow-up question. What integrative procedures can we explore? Okay.
Go, Doc.
Okay, very interesting. Very interesting, very interesting. EGFR is your estimated glomerular filtration rate. No? So that is a rough estimate of how well a patient's kidney is functioning. So the smaller the number, the less would be the filtration rate, the amount that the kidney is able to filter. So this means that lower number would mean a poorer kidney function. Now, PPARS liquid has a higher potassium content compared to the other PPARS products because PPARS liquid has the highest concentration in terms of the manufacturing process. No? Now, in this regard, of course, there would be we have to be careful about the potassium levels of the patient. However, at 42, this is not the level where we have to worry about potassium just yet. Yeah, usually we worry about potassium when the EGFR is further down around 15, less than 15, no? There would be some signs already of elevation at less than 30 of EGFR. So at this point, at 42, I would still not worry about the potassium. Now, people with for this case, I would advise a 1 vial once a day dosing. Yeah, 1 vial once a day dosing. So, then evaluate how the Parkinson's, stroke, and the prostate parameters are doing. Now, for PPARS liquid, the outcome that we want to get from this product is to lower inflammation, and that's it. No, it's to lower inflammation really, and to bring up the quality of life of the patient, to give the patient more energy, so to speak. No. Now, what other integrative medicine procedures can we explore? Now, this is not a medical advice for specifically for your case, but for the specific diseases. Okay. For Alzheimer's disease, Parkinson's, and stroke, we can explore exosomes and stem cell therapy. Exosomes came from stem cells. So stem cell therapy is where we give stem cells to a patient to help regeneration of tissues, damaged tissues. Okay, this stem cell therapy can even be for CKD. Okay, I will repeat, ha? I will repeat for those of you who lagged, for those of you whose internet lagged, okay? I will repeat. Stem cells cannot be given to cancer patients. Why? Because stem cells, when it attaches or when it goes near to another cell, it becomes that cell. So a stem cell, when it
Oh no, Doc Johnson's. Okay, he's back. Doc, you're back. You're muted, Doc.
You are muted, Doc. Okay.
okay, I was the one who got disconnected. Anyway, going back. So I'll repeat again, rewind. Stem cells cannot be given to cancer cells because stem cells, when it attaches or when it goes near to another cell, it becomes that cell. So a stem cell, when it comes into contact with a nerve cell, it becomes a nerve cell. When it comes into contact with your skin cell, it becomes a skin cell, etc. Now, when it comes into contact with a cancer cell, it becomes a cancer cell. Okay, so you would increase your cancer burden if you take stem cells, no? Also, another problem with stem cells is that it has a lot of growth factors, so it will make things grow. So this is actually very good for regenerative purposes, right? So for Alzheimer's, Parkinson's, and stroke, this is really a very good therapy to go for. However, the cost is really very prohibitive. Disclose, no, just to disclose, stem cells can range between 10,000 to 18,000. Okay, US dollars. Right? Now,
That
of
would
course,
be
no,
600
in order,
600,000 pesos to 1.2 million pesos. Yeah, per session.
yeah, yeah, exactly. So now, of course, since the cost is very prohibitive, they found ways on how to bring the cost down. Okay, so here comes exosomes. Now, how does stem cells rather, how does stem cells become other cells? How does it communicate with your normal cells? It produces exosomes. Exosomes, inside them are DNA, RNA, growth factors, proteins, etc. All used for regenerative purposes, actually for cell proliferation, used for cell proliferation. Now, these can be used for regenerative purposes. So what they did was to isolate the exosomes only, then package it into vials. And that's what we give patients. Now, one exosome session can range between 80,000 pesos to 120,000 pesos, sometimes even more. Okay? Definitely cheaper. But of course, for some patients, it's going to still be prohibitive, but there is a glimmer of hope because Parkinson's and Alzheimer's disease, no, it's stroke. Without exosomes and stem cell therapy coming into the picture, these are diseases wherein we don't have any cure at all, and you're gonna live with it for the rest of your life and wait until it progresses. And the only thing that we can do is to prolong the worsening. All right, so that's the only thing that we can do without these two. All right, now what aside? So, Doc, I cannot afford exosomes. What else can we do? Yeah, what else can we do? What else can we do? No. So for these diseases, we can explore ozone therapy. This is the ozone therapy can also be used for CKD patients. Okay, so this is also to help recovery or to help regeneration. But then again, it's going to be at a lesser degree. Okay, if it at all works. But at the end of the day, the goal is to improve quality of life. Okay, so if the procedure improves the quality of life, so hey, why not do it, right? So uh, yeah, there are still other integrative medicine procedures that we can explore for these diseases. We haven't talked about peptides. Peptides is actually a relatively new thing right now. I'll give you an example. Semaglutide or your Ozempic, Wegovy. So these new weight loss medications that's being sensationalized in the media by celebrities overseas. These are peptides. Okay, so peptides are proteins. No, these can also be used for these chronic degenerative diseases. Okay, yeah.
Very interesting. Actually, Doc, thank you for answering, because one common question is about the stem cell also here in something. So, Sir Sean, would you like to add anything?
Yeah, I wanted to add that, doc, for this particular patient, CKD, Parkinson's, so there is actually multiple challenges this patient has. So you notice also that when it comes to conventional medicine, each of the disease has a separate drug and treatment protocol. So what I just wanted to highlight here that Simply Nature PPAR liquid extract will be one of the most efficient supplementation and support this patient can have. Why? Because our PPARs actually work on the root causes of multiple diseases. So from the CKD to the Parkinson's, it's going to work on all of them at the same time. So when you combine specialized drugs and treatments for each of the different diseases, plus PPARs that works on the root cause of all these ailments that her father is having, then we really have a very wonderful combination and hopefully creating good results for the patient. I just want to add a personal note. My father-in-law suffered from Parkinson's and also passed on. I guess we would say he passed on in his sleep. All right, but it would probably be because of Parkinson's too. Because at that time, at that point, he was able to eat, but other bodily control functions like defecation and all that he had to be helped. I just wanted to share that he was actually on liquid PPARs, 1 vial a day every day, for the last year of his life. So I can't actually remember because he's passed on for quite some time. How long did he suffer from his Parkinson's? But I just want to make a few general comments. Is number one, it is a very tiring illness because thank goodness for my side, my wife has 5 other siblings. There are 6 of them, so they could rotate to take care of their dad, and that they were also able to combine the income to get a helper, right, to take care of the dad 24/7. So yeah, for smaller families, it could be very challenging and very tiring to have a Parkinson's patient. So my heart goes out to you. The good news is this. My father-in-law was on liquid and powder alternating. Again, management of cost, right? But one thing he did have that we saw was that his Parkinson's actually progressed slowly, and he was always alert and healthy. He was able to make 2 trips to the Philippines to visit my wife before he couldn't, right? And even to his last days, his appetite was very healthy. He still enjoyed eating. Yeah, and what we noticed was especially when he was on the liquid PPARs, the times when he's on the liquid PPARs, his shaking diminished. He seemed a lot more firm. So again, PPARS protocol can't cure Parkinson's, neither could it reverse, not that we know of, but it definitely does improve the quality of life, and that means a lot to the family members for sure, and especially for the patient as well. So just want to encourage you and let you know that, yeah, this is something me and my wife personally have, and that's also one of my personal convictions to be able to find solutions for brain disorders, especially dementia, Parkinson's, and Alzheimer's. These are things that weigh on our mind, especially in Singapore, where our families are smaller. And whenever someone is struck with Parkinson's, Alzheimer's, or dementia, it's a tremendous stress for their kids, and family. Yeah. So my heart goes out to you, and I hope this encourages you. And I think if you want to explore the alternative protocols, I think the best thing you can do tonight is to make an appointment with Dr. Jansen so that he can take a look at the case specifically and recommend some other protocols on top of the liquid PPARs. All right.
or better yet, attend our event this coming Saturday at SM.
Yes, see us in person. See our very handsome Dr. Jansen. But he's
I used to remember Doc Jansen's doing a consultation, and his patients are wearing makeup, very well prepared.
Sheila, don't say anymore. Dr. Grace, his wife, is listening.
Our number one supporter, of course. Hi, Doc Grace. All
Hi,
right, so
Dr. Grace. Yeah.
going to our next question coming from Mr. Vo Odds. So good night, good day, Doc. My case is lung cancer, and I'm prescribed to take Tagrisso chemo tablet. My question is, why do I still have to be injected with vitamins for the bones once a month once a month for 2 years? So waiting for your reply. Thank you, Doc.
Yeah, it's because lung cancer, so patients who have lung cancer, okay, you have a tendency to develop osteoporosis. Okay? It's not because of the medication, it's because of the fact that you have lung cancer. Okay? Now, the medication Tagrisso is a very good medication to combat lung cancer, especially if you have the mutation. Okay. Now, the mutation is EGFR positive, no positivity, or your EGFR is mutated. So this is a gene that has something to do with lung cancer. Okay. Now, kasi yung Tagrisso in and of itself also have several effects on the bones and bone marrow. So potentially you can develop bone pain because of this. It can alter the appearance of your nail, and other bone-related issues, right? But mainly the reason why we still need vitamins, minerals, no, for specifically used for your bones is because we would of course want to take care of your bones just because of the fact that you are a lung cancer patient. Okay, and of course it doesn't end there. We need to nourish your body properly. And if you're utilizing any other treatments, no, the nutritional supplementation would still be needed in order to prevent further side effects. Yeah, especially long-term ones.
Yeah, so I think when it comes to cancer patients, we are actually really very only limited. We should only be limited by our finances, right? So for cancer patients, me and Dr. Jansen always want to share with you every possible options you have, combination. To put it in a simple way to understand, right? If doing one protocol gives you 5% chance of beating cancer, another one adds another 10%, and then your chemotherapy adds a 30% or 40%. When all these percentages add up, it really gives you a really great fighting chance of victory. And another thing that Dr. Jansen and I, when we share, is this: we are not just looking at beating your cancer, we're also looking at how to strengthen and nourish your body. Just like, for example, this case, if you have lung cancer, you're prone to osteoporosis. So we are looking at the life after you beat cancer. And that also includes the chance of cancer coming back. I am sure all cancer patients, you've heard of stories of, or even maybe family members who did well, were declared in remission or cancer-free, so-called. And then 6 months later, they found that the cancer came back and has spread to other parts of the body. So this is something that the fight for against cancer should be something, your understanding should be greater than fighting the cancer. You're going to learn how to maintain the health of your body, the integrity of your immune system, the health of your other organs, in this case, bones, because these are all important factors that will affect your quality of life and you being able to get back to a normal life and lowering the risk of recurrence, which is the worst thing that can happen to a cancer patient, because when a cancer reoccurs, it is stronger and tougher to deal with than the first bout. One of the reasons, number one, is that a lot of your medical protocols can't be used anymore or will be less effective because this second bout of cancer, it can often be resistant to the effective drugs that you used to beat cancer the first time round. So we should do everything we can to lower your chances and eliminate recurrence. So this is where Dr. Jansen's advice and what we share on the program is, in addition to just fighting your cancer, we are putting thought and care about rehabilitating your body well and lowering your chances of recurrence. So yeah, that's a very good illustration tonight. Yeah.
Actually,
you.
I just want to quickly add that what your answer, Doc Jansen and Sir Sean's answers, are not to scare off them, because now that they know what to expect, like for example, they have lung cancer, but instead to encourage them more that they can actually fight it off. They are in a very good position to fight back. And yeah, so thank you for the encouraging answers, Doc Jansen and Sir Sean. So for our next question, thrown to us again privately, coming from Ms. Tina. Question is, can PPARS help with fibromyalgia? If yes, what do I need to take? And how about arthritis and gout?
Yeah, so those are diseases related to inflammation. So definitely PPARs would be helpful. At what dose would I start? Depending on your symptoms. If your symptoms are really very bad, you are really in pain, then start with the liquid. To start with, no, just take one box and see how you respond. Usually, before you even finish that whole box, you would feel better already. Yeah. So that's how I would approach this right now. While even when you just listen to this. Now, if you come see me, then we would have to further investigate and address the root causes of the problem. So for gout, then we have to address the metabolic issues, lifestyle issues. If there are any other diseases that's leading to your gout, yeah, arthritis, the same thing. We have to investigate these things, find out what the root cause is. For pain management, we can actually even use ozone therapy. So this is an added, additional things that we can do to help you. Can be used infusion therapies like vitamin C drips and these things, glutathione, yeah, definitely, because these are all related to inflammation and you would need high amounts of antioxidants. So the answer is yes. So which do you go for? Yeah, I have to talk to you to answer. No, but right here, right now, if you are experiencing really bad symptoms, no, go for the liquid.
Yeah, if not, go and have a consult with Dr. Jansen as soon as possible, or come on Saturday and meet us. Not only me and Dr. Jansen, but also Dr. Jimmy Katapia, one of the top surgeons in Metro Manila. We will all be there together, so you can, like a bumblebee, you can hop from one doctor and expert to another. All right. So I look forward to as many, and we have pretty strong sign up this time round. Yeah. So. Looking forward to everyone being there.
That's right. Well, if you're super excited to have a consult, you can definitely just type in how to consult, and our caring HTS or healthcare specialist, Ms. Beth and Ms. Irish, will definitely get in touch with you individually. All right. So for our next question, coming from Helen, I have breast cancer and I don't want to go for chemotherapy. I'm considering ozone therapy, but my question is, can ozone therapy be taken alongside PPARs?
No, the answer is no. Okay, the reason being is ozone therapy is oxidative. So what the mechanism of action of ozone therapy is, it gives you a little bit of oxidative stress to activate the antioxidant system of your body. So that's the mechanism. So when we give ozone, the ozone dose that we give to a patient would have to be able to overcome the ground antioxidant concentration of your blood. If not, then the ozone therapy will not work. All right? So if you are taking PPARS, which has very rich antioxidants, then it might destroy the ozone. Okay, so my advice is to take it separately. Take it separately. So how far away can you receive ozone and PPARS? I would receive ozone therapy first. If you are taking other supplements, you have to also avoid taking them. Okay, because supplements tend to have antioxidants in them. Okay, so ozone therapy alone, you can take your medication, no problem. Ozone therapy alone, then give 4 to 6 hours, then you can now take your PPARS. Okay, that's how I would approach things.
This is a great example why I think our viewers love this program, Dr. Jansen. Because even when we do totally integrative or natural protocols, there are details, right? Both PPARs and ozone therapy are natural. So natural doesn't mean that you can just mix everything together. There is science behind it. We do understand how each of these protocols work, and there is a proper place for each protocol. And sometimes, in medicine, the patients always ask you, right, is there a contraindication? Contraindication. Well, there is also contraindication even when you use different natural protocols. So you have to know how the protocols work. And that's why we are doing this program. Thank you. Sheila?
No, I'm just very curious. This ozone therapy, is it like done on an everyday basis, or how long? What's the frequency of this?
Okay, good question. Now, ozone therapy is a very broad term. It's a general term. So it's like vaccination. It's like the term vaccination. Okay, so it's a very broad term. Now, ozone therapy, there are a lot of applications under ozone therapy. So you can insufflate. So you can inject ozone to orifices. So your rectum, vagina, and your ear. Okay. Don't inhale ozone. As is, okay? Yeah, because that will cause lung irritation. That is where the danger of ozone is. Okay. How else is ozone applied? It can be applied topically. So if you have a wound, for example, diabetic foot ulcer, for example, you can wear a plastic around that area and expose that area to ozone. Okay. Another one is you can give ozone intravenously, okay? Not as a gas, okay? You dissolve ozone in a fluid, in a liquid, and then give that liquid, that ozonated liquid, to the intravenously. So we have ozonated saline, we have blood ozone or your major autohemotherapy, okay? We have that as well. Ozone can actually be given localized as well. So, for example, you can inject ozone in your joints, in your muscle, to help relieve pain, especially for patients who have arthritis. Okay, so these are the different applications of ozone. Yeah, actually, you can even develop products out of ozone. Yeah, or you can ozonate different products. So, and it can give antibiotic properties. It can give. It can help improve wound healing even.
In terms of like incorporating it with PPAR protocol, it's very doable. All right.
Yeah. Now, depending on what application you're using, you can receive ozone every day, or you can receive ozone once every week. Yeah, or a few days in between. So, but the most frequent that you can receive ozone is every single day. So for rectal insufflation, vaginal insufflation, ear insufflation, we give ozone every single day. Also true for bagging. Yeah, we give ozone every single day. Yeah.
Thank you. It's actually one of our common questions for people who are already taking PPARs already. Thank you, Doc. Okay, so for our next question, quite generic. Question is from Naan. How is the dosage for a benign breast tumor? Wow. Thank God yours is benign. So in terms of
that's a good question.
Yeah. For benign breast tumors, because the only options that you have right now is either to cut it out or to wait for it to grow larger. Now, if you really want to, if you want to not wait, do something about that, I would start with the liquid. Yeah, because the liquid would give you the highest amount of PPAR agonists to have a profound effect on the tumor, and hopefully the tumor goes away. Now, this is for breast tumors, no. So for other organs, like if, for example, you have thyroid nodules, I have experience using PPARS powder, and the thyroid nodules went away. The patient was actually scheduled for biopsy. It did not push through because the doctor performing the biopsy cannot find the nodule anymore that he wants to
Wow.
biopsy. So yeah,
Wow.
the doctor sent the patient home. By the way, this doctor was from the US. I don't know the name of the doctor, but that's what the patient reported. So
Wow.
But we
Wow.
so
actually
yeah,
have,
so mm,
Happy,
mm.
happy testimony. What a wonderful testimony. Yeah.
that's right. Congratulations. Yours is benign. And I'm very pleased that, even patients who have benign conditions are really, pushing hard to resolve their issues as early as possible. That's great. Now, this question was done to us last week by one of our YouTube watchers or audience. So coming from Mr. Roji, my father has stage 4 prostate cancer. What can you recommend?
Mm.
Okay, a lot of things, no, but it depends on the situation of your dad because stage 4 cancers in general, no, patients can still be quite strong, even with stage 4 cancers.
Yes.
So this is a very broad, still a very broad category. But of course, depending on how strong your dad is, you can likewise be as aggressive. Or if the situation is not that good, then we can just, try to help improve the quality of life and just try to, make his body as healthy as we can, right? With what is available for to be used. No? Now, yeah, very difficult question to answer because I have to know the history. So I have to actually see you. But just to enumerate things, no, that can help prostate cancer stage 4 would be, of course, PPARS. If there are any metabolic issues, I can use intravenous high dose vitamin C. I can repurpose medications that has off-label use for cancer, like ivermectin, mebendazole, metformin, and atorvastatin. We can also use plenty of nutraceuticals like your vitamin D3. We can use some herbs as well, like your curcumin, berberine. Yeah, these things, no, to help your dad fight the prostate cancer. Lifestyle intervention as well, no, very very important because though we are talking about stage 4 prostate cancer, no, but early stage prostate cancer was actually one of the one of the few cancers wherein lifestyle intervention alone was able to reverse it. So if it was, yeah, this is proof of concept. If it was able to reverse, early stage prostate cancer, then it might work with stage 4 prostate cancer with the help of other things. So yeah, definitely lifestyle has a role in here. So these are just a few in order to, make more specific recommendations. And I have to see you. Okay, but right off my mind, this is what possible things that we can do, no? Yeah.
Thank you, Doc. Would you like to add anything, Sir Sean?
No. Yeah.
Okay, all right. Okay, so for our actually for a while ago we were talking about elevated potassium. So the question actually is aligned to that one coming from Ms. Linda. One of the nutritional content of PPARS is potassium. And in my case, I am not allowed to elevate the potassium. So can I still take PPARS but in a different form?
Yeah.
Yeah,
The
of course.
The powder has little to no potassium content. But even the liquid actually has potassium content, as Dr. Jansen mentioned before. Depends on the seriousness. And in this case, I would definitely ask you to consult Dr. Jansen, since you actually have, strict orders from your doctor. So you want to be clear and confident, right? Yeah. And in most cases, there is always a risk-benefit balance, right? Like for example, chemotherapy hurts your body but then it kills the cancer. So it depends on what is most crucial and important. So certain level of risks are acceptable if the other illness that you are trying to treat is very critical and life-threatening. So again, I would suggest you have a consult with Dr. Jansen. Yeah, but if you're asking for the product that has low or to no potassium content or little potassium content, it's the extract powder.
Right. I just well, once again, for those of you who wish to have a consult with Dr. Jansen, just simply type in how to consult Ms. individually. Also, for Mr. Roji a while ago who asked about for his father who had prostate stage 4 cancer, if you are very much interested to attend our SMX this coming Saturday, but your patient is too weak to to attend the said event, then as a caregiver or as a loved one, you can attend on their behalf and ask the question to our experts on Saturday. So it'll be a worth it event to attend to. Okay, all right. So for our next question, can I still okay? Can I still, coming from Miss Erica, can I still use PPARS? I already finished my chemo cycle. Of course.
Of course. Yeah, there's many benefits. One is to lower, strengthen your body, how your body recover. All that is very important to mitigate or lower your chances of recurrence. So a good example is Sheila's son. He was actually on PPARS all the way for 5 years. And even now, he's past his 5-year mark. Congratulations to Dominic. He still takes, Sheila, does he still take the powder extract?
He does, but of course
What?
on a very low dosage.
And it's like once every quarter or alternate
Yeah.
month, something like that, right? Not every day anymore. All right. So yeah.
That's right. Okay. Well, thank you so much. Yeah, definitely.
Sorry. Let me let me give some more specific because she asked a question. I think we didn't give her an answer that she can act on. All right. Okay. I'll let Dr. Jansen chime in also, but this is what I personally would suggest. If money is not an issue, take another box of liquid and then extract powder after you've cleared everything, right? Why? You just want to make sure your body gets a strong boost and is starting off recovering as fast as possible and as complete as possible from your chemotherapy. Okay, so after that, I would suggest to stay on the powder extract for 3 months. That means 3 jars. All right. So this is when finances are very strong. We don't have any limitations or anything. Okay. If you do, I would still suggest at least 1 more jar of powder extract versus liquid because powder stretches over a longer period of time, right? 1 month. And then after that, go down to soft gel for 3 months and then go to tablets for maintenance. All right. Doc, do you have any specific protocols or maybe a different protocol that you find is effective?
Mm. Wait, let me go to the question again.
Done
Uh,
with chemotherapy, is it
wait,
still okay to take PPARS?
She's done with her chemotherapy.
yeah. You can use it to help you recover from chemo.
Yeah.
You can use it to help. Yeah, you can use it in this sense. But if you're recovering from chemo, usually I just advise patients to take the tablets and the soft gel. That's it.
All right. There you go. So I gave the Rolls Royce answer. If finance is not a limit, go for the extract. If it's not, then the efficient one, the one that you can take is soft gels or tablets. And I totally understand this because chemo itself is a very costly protocol. So many patients are actually financially drained after they finish their chemotherapy. But one thing I do want to say is that don't take nothing. All right, don't do nothing. At the very least, you should have absolute lifestyle change, right? If you can't manage a very healthy lifestyle change, be it due to circumstances from work, because if you go back to work, it's not easy to eat healthy if you're working in, let's say, Quezon City or Makati, and you have to eat from the staff canteen and you don't have anybody to help you cook food before. you know. So with that, I would definitely suggest, as Dr. Jansen said, minimum the tablets, if you can, the soft gel for a while, which a while meaning 1 month, all right. And then if not, at the very least, do radical lifestyle change. The thing that you cannot do is to do nothing, all right. You can't, after you finish your chemo and think all is well and go back to a totally normal life. You can't, all right. That would not be good for you, and of course that will not lower your chances of recurrence. Okay, yeah.
I just want to say that I'm actually very happy to hear questions like this. Even finishing the chemotherapy, they are off the battle already, but they are still trying to be vigilant. And something that I've learned from Sir Shyan and of course Dr. Jansen and all the other doctors here in Simply Nature is to continue to be vigilant, even in your remission and even in your survivor years. Yeah, and watch our regular webinar here to keep you grounded and always be reminded about what you need to do as a cancer survivor, of course. Now, I think this will be our last question for tonight, coming from Ms. Tanet Lungao. Can PPARS also help with myoma?
Oh yeah, yeah, definitely. Because myoma is a benign tumor. Yeah, definitely PPARs can help. No, so how does it help patients who have myoma? So myoma usually arises from hormonal imbalances. It has sometimes patients do have a background of insulin resistance, metabolic problems. So in this sense, PPARs can help fix the metabolic issues. PPARs can also help detoxify. Doing the detoxification would usually improve the hormonal control or the hormonal regulation of the body. So in this sense, yeah, definitely. Now, what protocol would be used depends on how bad the myoma is. The bigger the tumor, the more problems we have, then the liquid would be best for these kinds of patients. But say these are very very small, then I would choose the soft gel. Just the soft gel with the tablets probably would usually be enough. Okay, so but on the get-go, if there are a lot of problems, say for example the size of the myoma is more than 4 centimeters, you have a lot of issues, metabolic issues, your blood chem is, you have a lot of stars in your blood chemistry test, then yeah, for this case I would probably use PPARS liquid.
Sir Shyan, would you like to add anything?
No, I'm good.
I actually
Okay.
have a follow-up question, Doc. Alright. As a woman, no, as a lady, how is myoma different with PCOS? I mean, I understand that PCOS is usually gotten by women on the side. Is it also the same mechanism with myoma?
Okay, so PCOS is polycystic ovarian syndrome. So you have an issue with your ovary. Myomas are in the uterus, so it's a benign tumor in the uterus. So these are two different locations, two different organs. However, the root causes are usually the same. It's usually aberrancies, hormonal imbalances. These can arise from our lifestyle, the environment in which we are in, the products that we use for personal care, especially, okay? Especially for ladies, since you are, applying so many products on your body all the time. So these issues can come from the products you're using as well. No? So yeah, I would say these diseases are located in two different organs. They usually manifest in different symptoms as well. But the issue behind these two diseases or these two conditions have a lot of commonality.
Thank you so much, Lo. Right, we kind of have one pahabol question, last question thrown to us on the comment section coming from Ms. Catherine. Case is bone metastasis and patient is refusing to do biopsy. Is it possible? I think the question is, can PPAR still help?
Yeah, definitely PPARS can still help. But since we're talking about bone metastasis and you're refusing to do biopsy, then at this point, I believe the the path of treatment would entirely be non-conventional. Okay, so meaning medical oncologists and surgical oncologists would be out of the picture. So it would just be, integrative medicine. Yeah, we can. There's still some hope left for this case, but I have to see the actual scan of the actual scan, no, of the bones to say if there's still much hope left, or what we do would just be palliative in nature, meaning we just make the patient more comfortable. Yeah, but definitely whichever path we pursue, no, there would always something that we can. There's always something that can be done. It's just that the question is, would the patient be able to do so? Okay. Because in my practice, that's usually the case. No? So, for example, if I would require the patient to undergo intravenous high dose vitamin C, for example, the patient is living in the province or living abroad, then that would not be possible. Okay, so we have to explore other options. So that's why I really need to talk to the patient, to talk to the family, so we can arrive at the best decision possible for the patient um at the present. Okay, but um yeah, even I have a lot of patients who have bone mets. Some are still alive and kicking, some are strong. um um okay, I'll give you one. I had this one patient. She was wheelchair bound when I first saw her. So she uses a wheelchair all the time. The reason why she is on a wheelchair is because she had a fracture on her spine, which affected her spinal cord. That's why she cannot walk. Um, After a few treatments, interventions together with her onco, um, in her locality, she is now able to, stand up. So I mean, there's something quite promising. I not that I would be able to do so for every single patient that I would be encountering, but this gives us an idea that, hey, this is something real, that this is something possible to do. All right. So yeah, yeah, yeah. So I think that's my take on this.
Thank you, Doc. Sean, would
I
you
think,
like to add anything?
yeah, I just want to say, the way the question was asked, it really comes across. I hope I'm just reading into the question, is that as a loved one, you actually don't want to give up. You want the best option for your loved one. He has already bone metastasis, refused to go for oncological protocols. But it sounds like you, as the loved one, said, no, no, we gotta still do something. You still are holding out hope for that. Then here I would share that uh yeah, I think PPARS, I mean, I speak to many doctors like Dr. Jansen, and I have a few more like who actually see many patients in I guess in the Hail Mary stage, where they just hoping for the very best. So there are always cases of wonderful turnarounds, all right. But at the very least, I also want to share with you how much should we spend? I mean, this is an interesting question, How much should we invest in late stage cancer? What can you get out of it? How do you evaluate that? So this one is, I'll just share some examples, and hopefully that will give you I guess some clarity. The director of Simply Nature Singapore. So this is actually one of my board of directors. So this is very, very personal. Her father-in-law had, I think it was lung cancer metastasized all over the body. The doctor gave him less than 4 months, less than 4 months. He ended up living for a whole year. All right, he went on PPAR powder. Okay, and this is the amazing thing. He looked better and better as the year gone by. So he actually gained strength, got stronger. My friend, my director of my company, she was not especially close to her father-in-law, but because she took care of him during this period, right? Towards the last 4 months of his life, he actually became strong enough to travel overseas. They went on tour. And with this whole process, he got stronger. They had family dinners, a lot of family dinners, right? And she actually got to know her father-in-law very well. And she was, of course, we are Chinese Singaporean. So one of the key things in the Chinese Singaporean is to have an open casket funeral. I don't mean anything by this. I don't mean anything. I'm just sharing a story. I don't mean anything relating to your case. But so what happened was that the dad was actually not looking good, after the initial chemotherapy sessions, right? So in Singapore, if you are a cancer patient and let's say your skin turns black, your skin and bones, they actually close the casket. I don't know here in Philippines. They don't want the family members or friends and family to see their loved ones not looking good, right? So actually, for in our culture, to be able to have an open casket is actually something positive. So the dad actually looked so good at the father-in-law actually looked so good in the end. They were able to have a normal wake and honor the father and everything. So here is just an example of why a person would still invest good financial amount of I guess money to support a cancer patient in their last legs. Another one that I know personally also, this is my Lola. She is one of the first integrative doctors in the Philippines, right? And she, in her late 80s, she was already in her 80s, she actually worked at a hospice, a Catholic hospice. Okay, so she had a patient who had cancer metastasized to the brain, and then she was already in coma. Not coma, yeah, semi-coma, always lying in the hospice, And her sister, who had supported her entire treatment, right, flew in from the UK, right? She had actually sent 6 million peso worth of a remittance for her younger sister to undergo all the chemotherapy treatment. And the brother is actually the priest at the hospice, which is why she ended up in the hospice, right? So she came back and we put her, my Lola, Dr. NG Domondo, she actually put her on liquid PPARS. So after one box, I think after a week, she actually gained consciousness and was able to sit up and almost seemed like normal, back to normal, just not being able to walk around without assistance, right? And her sister had just came back from the UK, spent, I think, a week every day sitting in the hospice, talking to her, having conversations. And previous to this, she was lying like most of the time unconscious. So this was a huge change for this particular patient. And in the second week, on the last day of the second week, around there, she actually slept and returned to the Lord. But I think Dr. Domondo was just saying to me, too late, already so much damage and already did so much treatment. The body is past that point, but she was just so moved and happy with the results because of what the sister could do, spending the last moments with her younger sister whom she supported through cancer. So I just sharing that, there are many outcomes when we are looking at choosing treatment. It will be good to be clear what we want to do. So for your loved ones who has already metastasized to the bone, so that could be very painful. Is going to be painful. We will also want to think what when you go for treatment, what it opens up opportunity. If your loved one becomes strong, you might want to go on a tour. You might want to go and do whatever you can do, right? So these are some of the thoughts I just want to leave with you. I hope I didn't overstep any bounds or anything, but I just thought that this sharing could be useful for all our viewers today, especially those fighting cancer. Yeah, thank you.
I think what you just really want to echo out is to, don't do nothing.
Yeah,
And
don't do that.
whatever you're going to do, it would still help.
Yeah, and I want to say, sometimes, right, sometimes the purpose of our our treatment may not be to cure. Sometimes the purpose of our treatment is to alleviate pain. It could be to buy time so that you can you can tie up any unresolved issues in a family, in a relationship. So there are many reasons apart from trying to cure the cancer, right, that we do treatment. And I just want to open that up. Yeah, and that could be worth a lot of effort to do because some things are really important. I mean, if you wanted to bring, let's say, your dad to his last vacation in the place he really wanted to go, and you have the resources, you just need his health to be strong enough, right? If your dad always wanted to see Mount Fuji in Japan, and you actually have the money, it's just that you never had the time, right? And now that you do have the resources, you can bring him to Japan business class, stay in the best hotel, look at Mount Fuji every day, right? The only thing you need is his health, that he's strong enough to make that flight and the journey, right? So this is where the treatments that we go for can help us achieve things like that. So it's not only cure. That's my point. Sometimes when we fight against cancer, our goal may not be to cure. There may be some other things that are equally worthwhile fighting for. Yeah. Oh, am I frozen? I think Sheila is frozen. Okay.
Yeah, I think she froze. Lot of
Okay.
issues with the internet connection tonight. Yeah, because it's raining hard right now.
Yeah. No, okay. No, last
Yeah,
words from you.
here in Manila, yeah, it is raining really bad.
Yeah, same here.
Okay, yeah, last
No.
words from me. I want to see you guys on Saturday. I hope you can get your last minute registrations in because I would be introducing a lot of new concepts on Saturday. This involves situations wherein we have a lot of gray areas. So one example is, okay, I'm in remission. When do I stop taking these supplements? No evidence of disease. I don't have any my PET CT is negative. Do I still continue this? I mean, we're trying to prevent recurrence here, right? Shows makes sense for the answer might be yes, no, because there's no point in continuing. Heard stories wherein patients are practically in remission, then 2 3 years later cancer comes back. So yeah, do or not? We answered that question on Saturday. Another situation, I want to undergo, rigorous screening. If the tests or the results of the tests are actually even actionable. I mean, would there be something that I can do about it? Yeah. So I'll give you an example, no. BRCA1 and BRCA gene test. This would tell you that you have a high risk of developing cancer, of breast cancer, no? However, it doesn't show you if you have cancer already at that point. It's just genes. And what do you even take these things, no? These questions? So we would answer them on Saturday. So these are very, very new concepts. So I hope you can attend. I cannot discuss these things here in our AMA because we have a lot of questions coming in. So we have to answer those questions of the audience. But on Saturday, This is going to be a lecture type, which we have Q&A later. All right. So I hope you can attend. And last words, and I've been saying this again and again and again, no matter the stage of the cancer, no matter your situation, there's always something that we can do. As long as you're still alive and kicking. Yeah. All right. So I'll leave you guys at this, and I hope to see you on Saturday. So thank you for listening, and see you.
Yeah, same here. Want to see you on Saturday. And the good news is 2 weeks ago, it was declared tomorrow is a public holiday. So have a good rest tomorrow, right? And make your way to SMX Aura in BGC. I think we have a special deal. You can ask Sheila, right? Type in. If you registered a ticket, I think you can bring family members for free, something like that. Because we just want more people, and we understand, as a cancer patient, you don't want to be the only one hearing what the doctor said in case you forget, or worse, sometimes you may not understand exactly what the doctor said, and you want your children or the person who's actually more well-versed than you being there beside you. So do ask our CSOs about such. I think we have some arrangements like that. So just ask them. And SMX Aura is really wonderful. It's one of the nicest SMs. Please don't go to MOA. This is in BGC. Okay, SMX Aura, not SMX MOA. Okay.
Aura.
Yeah, Aura, and make it a family day. Because we start very early. I know some of you will say, why do we start so early? Because number one, we want to end by before lunch. And from our experience, the Ask Me Anything, that means the Q&A with the live panelists, goes longer than what is in the schedule, because people have so many questions, right? So do that, and after that, have lunch with your family. Take a look around SM Aura and Market, which is a huge Ayala mall right beside it. So I think it's a great day to spend with the family together, and then enjoy your long weekend. So we'll see a lot of you on Saturday face to face. Thank you, Sheila.
Thank you, Doc. Thank you, Doc Jansen. Thank you, Sir Shyan. We are so excited to see you both in the upcoming event this coming Saturday. So please stay tuned. I have a lot of exciting and amazing announcements for tonight before we wrap up. So I just want to say, of course, once again, thank you to our two gentlemen, two experts, Mr. Shyan Lim and Doc Jansen Kalalan, for answering our questions tonight. And we are looking forward to this coming Saturday. Now, for our viewers as well, thank you so much for joining us today. Remember that taking action in your cancer journey is a powerful step toward healing and strength. We hope that you felt empowered to make informed decisions and take control of your path forward. Now, if you or your loved one is battling any type of cancer, any health issue at all, well, science is evolving and new treatments are emerging all the time. So keep informed and explore all available options. Don't forget to like our Facebook page, Simply Nature International and Simply Healed Medical Group, and Dr. Jansen's Kalalan Facebook page. And subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events. Everybody, elevate your organization's wellness initiatives by partnering with Simply Nature International. Whether you're planning a seminar or webinar, Simply Nature delivers science-backed and engaging and transformative wellness experience that will inspire positive lifestyle changes with a dynamic team of health advocates and access to this coming Saturday. Tickets are ramping up. It's almost filled out, actually. The seats are always filled, are almost filled. So please get in touch with us if you intend to do a walk-in, okay? But we prefer that you talk to us first so that we can register your name. So when you get there, you can smoothly go in and register to the said event. Now, like of course, the big question usually is that, can biopsy make a cancer spread, or is your body strong enough to survive the surgery? Whether you are the patient or you are representing your patient going to the event, the answer is actually this coming Saturday. Because we are calling all cancer patients, survivors, and advocates, and yes, even doctors. This is your moment to gear up and reclaim your freedom from fear and uncertainty of illnesses. Happening this June 7, Saturday at SMX SM Aura at 8 a.m. The title of our seminar, face-to-face seminar, is Freedom from Cancer, Latest Strategies and Live Panel with leading experts. Our panel of experts, once again, is composed of a PPARS expert, lifestyle medicine doctor, integrative doctor, and surgical oncologist. Take advantage of the face-to-face AMA or Ask Me Anything portion, where you can ask our experts live in the flesh, right? So tickets for the face-to-face and Zoom setups are now available, still available, but running out, okay? You can still buy your tickets. Please message us immediately. Okay? So buy your tickets for this exciting event now. So I just want to make a shout out to all the Freedom from Cancer seminar attendees. You are in for a treat because we have an exciting lineup of promos exclusively for the event attendees. You are going to get a free bottle of PPARS tablet that is worth 1,950 if you buy PPARS liquid extract. But if you buy PPARS jar of PPARS powder extract, you will get 5 sachets of Cleansing Plus, which is worth 800 pesos. Another exciting promo is that if you buy 3 individual packs of soft gel capsules, in Tagalog, this is the banig, no? If you buy 3 banigs of the PPARS soft gel capsules, you can actually get an extra free banig. So you're buying for 3, but you're getting 4. Wow. So that, which is worth 3,700 free. Okay. And another exciting one, get a free sachet of Cleansing Plus just if you buy a minimum of 2 bottles of PPARS Plus tablet. But I know these are so amazing, but if you are coming to the SMX SM Aura for the said event, okay, you can actually get a free Simply Nature umbrella on top of the promos that I just mentioned to you guys. So please attend or prefer to attend the face-to-face seminar. So seats are nearly full once again, so please get in touch with us on how you can attend the said event. Okay. Now, for those who are intending to buy our products using your credit card, you can buy through our website and avail, you know what? We have an ongoing promo, which is the free shipping via website. That's www.simplynature.ph. If you buy a minimum of 3,700 pesos, you can get the product with a free shipping promo. Okay? The promo runs until tomorrow, Friday only. This is for the free shipping. Okay. So, once again, experience the benefits of PPARS at an unbeatable price, because now is always the best time to get the best health, not only for yourself, but of course for your whole family. Experience the benefit of our products. Okay, so another exciting event, of course, apart from this coming Saturday, is of course another Simply Healed webinar happening next Thursday, same time, 7:30 p.m. Okay, so thank you once again for spending your time with us tonight. And of course, your commitment to healing inspires us. Remember that every step that you take is a step forward, and you don't have to walk this journey alone. Once again, this is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group. And your curiosity about your health conditions and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. See you on Saturday at 8 a.m. at SMX SM Aura. Good night and God bless you all.
Hi everyone, Shyan here. I'm very excited to announce our very first face-to-face in-person meeting for 2025. Freedom from Cancer, we will be exploring the latest strategies on fighting cancer, and there will be a live panel with the leading experts. You're gonna have exclusive access to get straight answers to your cancer questions. On the panel will be myself to answer any questions you may have about the Simply Nature PPAR Protocol. We have Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, who will answer all your questions about surgery. Last but certainly not least is Dr. Jansen the top specialist in supporting cancer treatments. All three of us will be there answering your questions together. So no more confusion, no more conflicting answers. You will get clarity on June 7th, Saturday, 8 a.m. to 11 a.m. SMX Aura. And also there will be cancer survivors who will be there to share their story and how they succeeded in fighting cancer. So once again, see you all June 7th, SMX Aura.